What does a spinal tap reveal when diagnosing MIS? Imagine trying to solve a complex puzzle where some pieces are hidden deep inside the brain and spinal cord. A spinal tap, or lumbar puncture, is like gently peering into that puzzle to find clues. It's a procedure where a doctor inserts a thin needle into the lower back to collect cerebrospinal fluid, the clear liquid surrounding the brain and spinal cord. This fluid can tell us a lot about what's happening inside the central nervous system. When diagnosing multiple sclerosis, the spinal tap looks for signs of immune activity and inflammation that are characteristic of the disease. One of the most important things it can reveal is the presence of oligoclonal bands. These are specific patterns of immunoglobulin G antibodies found in the cerebrospinal fluid but not in the blood. Their presence indicates that the immune system is actively producing antibodies within the central nervous system. This intrathecal antibody production is a hallmark of multiple sclerosis and is considered a key supportive marker in diagnosis. While oligoclonal bands are very common in multiple sclerosis, they are not exclusive to it and can sometimes be seen in other inflammatory conditions of the brain and spinal cord. The spinal tap can also show mild pleocytosis, which means a slight increase in white blood cells in the cerebrospinal fluid. This suggests some level of inflammation within the central nervous system. Additionally, doctors look for elevated protein levels, which can also point to inflammation or immune activity. These findings, combined with clinical symptoms and MRI results, help build a clearer picture of whether multiple sclerosis is present. In recent years, new biomarkers are emerging, such as measuring free light chains and neurofilament light chains. These can provide additional insights into disease activity and progression, helping doctors tailor treatment plans more effectively. It's important to remember that a normal cerebrospinal fluid analysis does not completely rule out multiple sclerosis. Some people with MIS may have normal CSF findings, so the spinal tap is just one piece of the diagnostic puzzle. The role of the spinal tap is especially valuable in cases where MRI results are inconclusive or when doctors need to differentiate MIS from other neurological conditions that have similar symptoms. Conditions like infections, other inflammatory diseases, or different autoimmune disorders can sometimes mimic MIS, and CSF analysis helps distinguish between them. It's also useful in cases of a first neurological episode, called a clinically isolated syndrome, where the diagnosis is uncertain. While MRI scans have become more advanced and sometimes allow for diagnosis without a lumbar puncture, the cerebrospinal fluid test remains an important tool. It provides direct evidence of immune activity within the central nervous system that can support or clarify the diagnosis. Ultimately, the spinal tap reveals immunological markers like oligoclonal bands that support the diagnosis of multiple sclerosis, help differentiate it from other conditions, and guide treatment decisions. Always remember to consult healthcare professionals for personalized advice, as each case is unique and requires careful evaluation.